Good evening, people. Welcome to Tuesday's edition of Community Health Screen UK. My name is Dr Mekella Mehmet Yesil, and on my show this evening, I'm going to introduce a psychologist from Pakistan by the name of SUNBUL KAZMI. Hello,
Hello everyone.
SUNBUL. Welcome to the
Hello.
show. How are you?
I'm good. Thank you so much for having me.
Welcome, welcome. How are you? You're okay, yeah?
Yes, we're okay. We're
You're
good.
okay. Nice deep breath. We're fine. Right. Somber, what I'd like to do before I start with the show, just tell us a little bit about yourself, where you're from, what you do for a living, and a little bit about yourself, about your career, if you don't mind, just for a few
Okay,
moments.
sure. So I'm SUNBUL KAZMI. I'm a psychotherapist, and I'm based out of Islamabad. And I've been in Pakistan for almost 9 years now. And before that, I was in Oman, and before that, I was born and bred in Saudi Arabia, Jeddah.
Okay.
Yes. And so these are all the factors. I've met so many different kinds of people and lived among so many different cultures, and people have always interested me. Psychology has always interested me, even though
Hmm.
this was not my first career choice. I
Hmm.
have an MBA in marketing. I was in corporate for 10 years,
Wow.
but yeah, and but then there was an incident that marked one of the darkest times in our Pakistan's history, and
Okay.
there was it involved children, and there was a massacre, and that was
Oh.
probably that was the moment where I decided that I this whatever I'm doing, this corporate life, this I don't want this.
Hmm.
And there's so many people that are hurting, and there's so much that needs to be done. We don't have enough people working in this field in our country, and
Hmm.
I wanted to contribute somehow. I wanted
Okay.
to help, so that's
Hmm.
why I opted for psychotherapy.
Hmm.
And this is what I've been doing for the past 5 years,
Hmm.
and this is my fifth year in the field.
It's quite a challenging career to have, isn't it? Psychotherapy, isn't it? It's quite
It has its
challenging.
moments. It
Yeah.
has its
Well,
moments, yes.
okay. How are you finding communicating with your patients at the moment? Obviously, we're in unprecedented times. We can't exaggerate that as much as we can, but obviously challenging times for everyone on a global basis. How are you
Indeed.
coping in Pakistan?
Indeed.
How?
So, my clients, my patients, whether
Mhm,
they're in Pakistan or outside of Pakistan,
mhm,
uh, a lot of them were already online, the ones who are outside of Pakistan, but the ones who are
mhm,
inside of Pakistan aren't who are in the same city.
mhm,
It has taken away from the quality of work in the sense that we'd sit in front of each other. A
mhm,
lot of work in psychotherapy is done by being very aware of your client's body language,
mhm,
the way they're responding to certain things, not
mhm,
just in speech, but also in their behavior. So that element has been taken out of the equation, and
mhm.
everything's being done online. Um, there's a surge in the need for this. The
Okay.
frontline workers as well. We need a lot of support, and luckily, a lot of therapists right now are doing pro bono work, which
Mhm,
I'm really proud of them for
mhm,
doing that, and I hope they're getting supervision
mhm.
for free as
Of
well
course.
for that.
Yeah, of course. Yeah, of course. Of course. Okay, Sumba, what I'd like to do then, basically you're a psychotherapist, and what is the
Mm.
approach and how does it differ from traditional approaches in therapy?
Okay, so today I wanted to talk about the impact of culture.
Mhm.
But before I did that, I wanted to also introduce I wanted to give you a bit of a history on this.
Sure.
Um, so around the mid 19th century, right?
Mhm,
A lot of psychoanalysts they wanted
mhm,
to be taken more seriously by the medical community,
mhm,
so they started to use the physiological framework
mhm,
to understand and also explain illnesses,
mhm,
and because that is the framework that was being used by the physicians at the
mhm,
time,
mhm,
biological markers.
mhm,
But what happened was that there was a growing need to incorporate social factors as well, psychological factors in understanding illnesses.
mhm,
So there was a growing traction
mhm,
towards the research that was being done for psychosomatic illnesses,
mhm,
their validity,
mhm,
that they happen and how
mhm,
they happen.
mhm,
And so in 1977, Dr.
mhm,
John Romano and
Mm-hmm.
Dr. George Engel,
Mm-hmm.
they proposed the biopsychosocial model
Module, yeah, that's
uh,
right.
to understand illnesses, whether they were physical or psychological.
Mm-hmm.
They believed that a person is influenced, their illnesses are also influenced by the biological factors, the
Mm-hmm.
psychological factors,
Mm-hmm.
as well as the social factors.
Mm-hmm.
And every person, every individual is different because of their thoughts, their feelings,
Mm-hmm.
their history.
Mm-hmm.
And so that is how the BPS model
Mm-hmm.
came about.
Okay. And that's how you adapt it to your patients, obviously your clients back home in
Yes.
Pakistan. And are they
Mm.
comfortable with you with using this sort of module?
I think it really helps.
Okay.
It really helps because it puts things in perspective.
Mm-hmm.
So imagine this, that all my training is
Mm-hmm.
being done based on the theories
Mm-hmm.
that were developed at a certain time by within a certain culture by
Mm-hmm.
a certain people
Mm-hmm.
who may or may not have been familiar with how things are done in my part of the world.
Mm-hmm.
Now, those theories, I have to, if I go and apply those theories locally, it
Mm-hmm.
might alienate my client. My
Okay.
patients might feel that they're not heard, they're not
Mm-hmm.
understood.
Mm-hmm.
For instance, if a patient comes to me and says that, after a few sessions, they say that I'm possessed by a jinn.
Okay. I mean,
I
how do you deal with something like that? How do you deal with it? How do you say to somebody?
So, first of all, to me, or to all of us, the psychotherapists in our community, the first thing that we're taught is that you need to have unconditional positive regard for the person in front of you.
Mm-hmm.
You need to listen to them, you need to empathize and not sympathize. By
Mm-hmm.
empathy, you need to understand where they're coming from,
Mm-hmm.
why they say the things that they say, and why they believe the things that they believe. We
Mm-hmm.
may not understand their belief system, but we need to respect it.
Mm-hmm.
So, first of all, those my own beliefs, my own ideas, my own values, they need to stay out of that
Yeah.
therapeutic space.
Yeah. Yeah.
It's
Yeah.
there. There's no space for
Mm-hmm.
my
Mm-hmm.
biases, for
Mm-hmm.
my opinions.
Mm-hmm.
So I would listen to the client.
Mm-hmm.
I would listen to this person and I'd be like, okay, say more. What's
Mm-hmm.
going on? How does it manifest?
Mm-hmm.
Now, if I'm not familiar, I should want to become familiar. I
Mm-hmm.
should want to understand where they're coming from. Now, how do I deal with this? What's the treatment plan going to be
Mm-hmm.
in this situation? So there's nothing in the books, right?
Mm-hmm.
But
Mm-hmm.
then there is.
Yeah.
But then there
Yeah.
is.
Mm-hmm.
There's Jungian psychology. There's so many different theories in place that take
Mm-hmm.
into account how you address something like that. I may go to sit with my supervisor and say there is a dissociative identity disorder.
Mm-hmm. I get that. What about
I
from
may say there's a split.
Okay.
Hmm.
What about if someone's got schizophrenia? How would deal with it as a psychotherapist? Because obviously sometimes they may need medication. If it comes down to
Mm, mm.
medication, is it medication? Is it counseling? Where do we draw the line between treating somebody and like helping somebody? Because they do two different factors at the moment, aren't they?
Indeed.
Yeah.
So the I got my degrees from the CPCAB UK.
Mm-hmm. Mm-hmm.
The CPCAB UK uh, advises us to do different assessments when we
Oh,
take the
okay. So you do the
psychon, right?
assessment, the 20
There are
questions.
the
Yeah.
BPS there's a BPS assessment, there is the biopsychosocial
Mm-hmm.
assessment, there's a presenting issue assessment, all of it. We take all of that into account. We have psychotherapists
Mm-hmm.
that we work in tandem with if need be. So
Mm-hmm.
in cases where we know that there is a situation where there needs to be some medication, there
Yeah.
needs to be medication, but there also needs to be therapy
Yeah, absolutely.
side
Yeah.
by side. So we
Mm-hmm.
work in tandem.
Okay, that's right. Yeah. Okay, that's
Mm,
understandable, obviously, because sometimes
mm,
I know with schizophrenia or people who have bipolar disorder or some sort of
mm,
cognitive behavioral problems,
mm.
sometimes they need to have it like have the medication to help them before we can
Yes,
start with the therapy. But that's
indeed.
fine. Okay, that's fine. Okay, and obviously you said that you're a biopsychotherapist. So what's the approach? My second question to you is this an approach used by all therapists? And if so, why not?
So just by what we were talking about right now,
Mhm.
you must have noticed that there is we need more resources, right?
Mhm. Mhm.
If you have a case like that, in case I'm so sorry, is this
Mhm.
on? Yeah.
Yeah.
So in cases where we need to work with other medical specialists,
Sure.
or we need other, social healthcare workers, for instance, we need collaboration.
Yeah.
This can become expensive.
Of course it does. Yeah.
It may not be seen as cost effective.
Mhm.
Furthermore, a lot of people, because of the way our societies are built right now, or the way they have been functioning, uh, before COVID-19, I must add,
Mhm.
uh, there was a lot of people don't have the time,
Mhm.
and they try to look for shortcuts,
Mhm.
which may be problematic because then your underlying issues are not being addressed,
Mhm.
right? So
Okay.
the criticism leveled on the BPS approach, or going through all the assessments and everything, is that it's not cost effective. A lot of by the way, a lot of companies over here do not cover mental health insurance. There is no mental health
Okay.
insurance that is being
Mhm.
covered by in my country.
Mhm.
It's problematic. It's seen as
Yeah.
something that, do you think you can just manage it? Do you really need this? And if you do, even if you can convince your employer that this is something that you might need to pay me for, they'd be
Mhm.
like, okay, I'll give you money for like what, 5 sessions. The rest of
Okay.
it's going to come out of your own pocket. So a lot,
Okay.
because of the cost of it. When clients come in, they say, listen, I cannot come here indefinitely. I want a set number of sessions. And then therapists start going for really, they would do CBT, or they will do DBT skills, or they'd be like, okay, I'll just show you how to be mindful.
Mhm.
I'll just explain to you how to meditate or breathe, and handle your anxiety when it happens. And then they would
Mhm.
not be doing all these assessments. Now,
Okay. So they're
having
missing a lot of crucial factors then in that patient.
mm,
Yeah.
they are indeed,
Yeah.
because here's the thing, that's a band-aid on a very deep wound. you
Absolutely,
know
yes. Yeah, absolutely. Because they're not looking at the triggers, they're not looking at
no,
underlying issues, they're not doing
no,
family history, they're not doing
no,
diagnostics or anything like that. Okay.
no.
Right, let's have a look. Let's have a look. Third question. So, looking at the social aspect in this approach, how important is the role of culture in mental health? Now, mental health here in the UK is a big one. And I know globally it's going to be a big issue, not 6 months or a year from now, 2, 3 years
Mm,
down the line. What's going to happen is we're going to get people with PTSD, post traumatic stress disorder.
mm,
If you
mm.
can explain a bit about that, that'd be great.
Okay, so culture and the role that culture plays in
Hmm.
mental health.
Hmm.
When the BPS model was introduced, Dr. Engel,
Hmm.
he said that culture is a very important factor. So even though culture is often relegated just to the social bit of it, our culture impacts our biology as well as our psychological health, right?
Hmm.
So it's important for practitioners to understand that culture is going to play a very big role. It's our, what is culture? It is
Hmm.
everything, right? It is
Hmm.
our customs, our values, our belief systems. It
Hmm.
is our traditions. It's our motives. It's our
Hmm.
rituals.
Hmm.
And the thing is that it's impacting biology as well, right?
Hmm. Hmm.
Your culture, the food you eat, how you
Absolutely.
interact with the environment,
That is that right.
if
Yeah.
and when you have children, the number of children you're going to have,
Hmm.
the drugs that you're going to take, whether or not you're going to vaccinate your child, is also
Yeah.
going to be influenced by your culture.
Of course.
Um, and scientists have already coined it as, the gene culture coevolution theory.
Hmm.
They say that these things interact constantly.
Hmm.
They are evolving, in a natural progression,
Hmm.
where there's an interplay between the two things.
That's right. Yeah.
So now, if you look at the COVID situation, what's going to happen is, even now, right
Hmm.
now, while
Hmm.
we're supposed to be, a lot of countries are supposed to be in lockdown,
Hmm.
how people are approaching
Hmm.
this is, again, it's probably their culture is going to have an influence.
Hmm.
A lot of people may look at this virus as something that it was bound to happen.
Hmm.
There are a lot of theories out there, right?
Okay, yeah.
No matter,
Conspiracy theories. We won't go there with the conspiracy theories, but
no,
yeah,
we won't, we won't,
there's so many
because
of them. There is
we're
so
just going to keep.
many. Yeah,
There's
we'll
so
dig
many, and we
ourselves a
actually
hole.
don't know.
Yeah,
We don't know.
exactly.
I'm just saying, listen to the experts. That's all we can
Yeah,
do right now, right? That's all. That's my
absolutely.
only, my
Yeah,
only
absolutely.
input with
Absolutely.
that would be like just listen to the experts, see what they say, right?
That's right.
But
Yeah.
right now, what's happening is the way a society, a way a people approach illness or views it is also influenced by their culture.
Mm-hmm.
At 10 o'clock, since the lockdown, at 10 o'clock, this is way past the last evening prayer. It is past Isha. Uh, we have a prayer. There's azan and then there's prayer in mosques, uh, because they're praying because of the situation and they want this to end. So there's
Mm-hmm.
prayer here.
Mm-hmm.
In some places, they might be doing something else.
Mm-hmm.
And I'm not even going to get into the rights and wrongs of it. There is no right and wrong. When you
Mm-hmm.
look at culture, when you approach someone with a different culture, we have to bear in mind that this is as real to them as your culture and your customs are real to you.
Mm-hmm. I
There
suppose
is
the
no
way
wrong
that
and right.
I suppose the way that each country is dealing with it. I mean, obviously we're in the
Mm,
UK, so we have like
mm,
214 different dialects,
mm, mm,
different cultures, and
mm.
we're different to Pakistan. I'm not sure. Is it 5 or 7 different cultures or things that
So
you have?
within Pakistan, now
Mm-hmm.
here's the thing. So there's
Mm-hmm.
there's culture, then there's subcultures, and then there's smaller systems within those subcultures,
Mm-hmm.
which is a crazy Venn diagram if you
Mm-hmm.
actually look at
Mm-hmm.
it, right?
Mm-hmm.
There are a lot of overlaps, and there might be things that we're not accepting from other people, and there might be things that we may have internalized by now.
Okay.
Within Pakistan, and this I'm just talking about the linguistic
Mm-hmm.
and geographic grounds, we have 5 to 6 cultures.
Okay.
And they have their own customs, their own traditions, they have their own language, the way. And when I say language, I'm not just talking about the spoken language.
Mm-hmm.
It is how we interpret things,
Mm-hmm. Mm-hmm.
how we interpret life.
Okay.
So this is just Pakistan.
Wow.
So there's a lot of complexity here.
Mm-hmm.
However, and that is exactly why we cannot ignore culture when we are dealing with people's mental health.
Mm-hmm.
We have to, and if we don't have an idea of where they're coming from, there is no shame in asking. There is
Yeah.
ask different questions,
Mm-hmm.
ask them differently. Dr.
Mm-hmm.
Jessica Deer,
The
she says that
approach has to be different.
compassionate,
Yeah, yeah, yeah. I think that's where
compassionate,
I think that's where
open
a lot of
minded.
that's where a lot of problems occur when people approach a doctor's surgery or their therapist, and they have this white coat stern attitude. What can I do for you? And it's not, oh, welcome, come inside, tell me
Mm,
what's going on inside your head. How can
mm,
we help you?
mm,
A lot of the time even doctors don't even know the patient's name when they call them. They look at, they're hunting around for bits of paper
mm.
because they're overworked, everything going
Yes,
on, so much of
yes.
it, unfortunately, so much. Right, and let's go to your fourth question, Sombul, if that's okay.
Mm,
So we talked about culture, and we talked about you and your role as a therapist and everything else like
mhm,
that. Talk a little bit about
mm.
some of the patients that you work with, sort of people that come to you, roughly.
Mm, all kinds.
All kinds. Do you have families? Do you have individuals?
So they're
Do
individuals. I've
mm-hmm,
worked in the rehab as well. So there's
mm-hmm,
addiction that
mm-hmm,
I've worked with. I've worked with schizophrenia, bipolar disorder, anger management issues.
mm-hmm,
I do see couples as well
mm-hmm,
to counsel them. And when we're working in the rehab,
mm-hmm.
uh, there the likelihood of there being a family dysfunction
Mhm,
is really high. So
mhm,
we also have to work with the families to
mhm,
see that when this person leaves the rehab,
mhm,
uh, they go back to an environment that is going to help them
mhm.
kick the habit rather than bring that habit back on.
Mhm.
And
Okay.
so
What
there
sort of habits would you
we've got that
say?
as well.
What sort of habits?
I mean, drug addiction right now,
Like
for instance,
hard drugs, like the stuff,
like
the serious
cocaine,
stuff, cocaine,
cocaine,
heroin.
and yes, heroin,
Yeah.
all of
Okay.
it. So
Really.
that's when we're working with, we have doctors on board. We have,
Okay.
and so the kind of therapy we do is now that, for instance, if so each client for the 3 months that they're there, and this is the minimum time, the 3 months that we have this patient, the inpatient, we will have two psychotherapists seeing this patient every week, right? So we divide it between us, like 3 days I will go, for instance, and 3 days my colleague's going to go and see and sit with them and do their psychotherapy, right? And every week, once a week, they're going to have occupational therapy. So that's a group therapy setting, and over there we teach them so how occupational therapy works with clients with addiction, right? Or any behavior that they're trying to get rid of. For instance, it's anger, right? So in our OTs in occupational therapy, what we do is that we say, okay, so whatever addiction you've had is a crutch, right? Any addiction we have, whether it's workaholism or
Gambling.
alcoholism, all of those addictions. Addiction is a crutch. What are you trying to not face, or what are you having difficulty facing? And then we're going to give them the techniques and tools and resources to use better means to cope
Okay.
instead of using, maladaptive coping mechanisms.
Okay. Do you find that the families are supportive of the ones that come in, like your patients? I mean, I don't know what sort of age group or gender they are, but do you find that it's very young, or they're very old, or the in between, or do you think it's people who've been traumatized as a child, that have been abused, that they've turned to drugs or alcoholism or anything like that? Or do you think it could be just because of any other reasons, sort of socioeconomic or finance or relationships,
All of those.
perhaps? All of those. Okay.
Unfortunately, a lot of people that go to certain rehabilitation centers are those that have the means to be there. So I wouldn't talk about the economic aspect of it, because they have the means to be there. There is abuse plays a major role. Is it always the case? Not always. That may be oversimplifying it. There are various reasons, and that is why it's important to, in that room, in that space,
In the
to be
atmosphere,
present
yeah.
with the client and see what is going on with them and what it is that's hurting them, and that can vary.
Yeah, it can be quite distraughting sometimes to see somebody sort of break away and actually tell somebody that they don't know how they're feeling and why they are where they are. It takes a lot of courage and a lot of strength.
It takes so much strength, and I am
Yeah.
so proud of them. I am so proud. There's this, the
A release, an
they're
immense
brave
release.
people.
Yeah.
They're brave people to face their demons,
Yeah.
to open up to someone. This is a lot of responsibility. This work comes with a lot of responsibility. You're going to be carrying a lot of things with you out of that room. Once you're
Yeah.
out, you leave that space, you are carrying things, and especially when you've experienced near with someone. And
Yeah.
that's where, supervision comes in. It's
Yeah.
very important. It's highly advised. It's something that every therapist must have, so that you're constantly aware that your own issues are not coming into the room, that you're dealing with this in a fair and just manner.
Yeah, that's
Of
right.
course, we take
Yeah.
care of client confidentiality. We completely take care of that. It's all genders
Of course.
that we
Yeah.
see. We see
Yeah.
all genders, and as far as age groups are concerned, I've seen people from the age of 11 to the age of, one of them was uh, 56, I believe. So it's all ages, it's all genders, and because end of the day, on a very basic level, we all hurt. Um, we all have certain needs. We may have a different set of needs, and and we all want those needs met.
Yeah, that's right. Okay, SUNBUL, thank you for that. You've touched on that quite well and quite deeply, actually. That's been quite touching, to be fair. Thank you for that. Right, let's go to our sixth question now. We've got like a few minutes. Well, actually, we've got about 7 minutes left, so we can touch on question number 6. And if we've got more time, we can just end on a, on a mutual thing and just talk about the mental health in general. On the sixth
Sure.
question, how can someone who doesn't have exposure to different cultures or an in-depth understanding of a particular cultural background have culturally informed approach to treatment?
Okay. So somebody said this beautifully, right? The
Mm-hmm.
best way for a person to know their own culture is to learn about other cultures.
Mm-hmm.
How we respond to other people's culture says a lot about who we are,
Mm-hmm.
what we believe,
Mm-hmm.
what because a lot of times you're not even aware of it until we
Mm-hmm.
are, when until we speak with someone.
Mm-hmm.
So self awareness is the first step. It is
Mm-hmm.
the most important step. Know who you are. Know
Mm-hmm.
your culture. Understand how you view yourself in the society. What are the factors that play into it, right?
Mm-hmm.
And know your own uh, possible biases, acknowledge them, see what you need to do about them, and
Mm-hmm.
then be very open with your client. Sit with your client, give them unconditional positive regard,
Mm-hmm.
be open minded,
Mm-hmm.
be empathetic,
Mm-hmm.
be compassionate, don't judge.
Yeah, that's what I
Judgment
was just going
is
to
the
say. Not,
end of
not to be judgmental.
everything.
Judgmental. That's absolutely right. 100%
It is
crucial.
terrible,
Yeah.
and a lot of times, and don't take offense
Yeah,
if
of course.
because here's the thing, biases go both ways. I
That's
have had
absolutely
clients who have
right.
come in, and 4 sessions later they've said, you know what, you're actually pretty cool.
Yeah.
When you first came here and they're like, when you first came in, we saw your scarf, we were just taken aback. We're like, what, how much do we tell
Yeah.
her?
Yeah, yeah. Because they think religion, they don't see culture, they see religion. And I've noticed that here when we have doctors in hospitals who are covered up and what have you. Oh, I don't want
Mm,
to be seen by
mm,
him or her or whatever for whatever reason
mm,
because
mm,
he looks
mm,
Muslim or he looks like this
mm,
or he's
mm,
this color or what have you.
mm,
So we do have that.
mm,
We're quite
mm.
judgmental. We don't do it,
And
not, I'm talking as we as a
it's
society
a
in
collective human,
general.
yes, this
Collective
is how
humans,
it is.
exactly. Yeah.
We
So,
like things simple, right? In general,
mhm,
people like to simplify things, oversimplify them, and that is exactly what we must not do.
mhm.
Even when it comes to culture, just because one Pakistani or one Chinese or one Indian does not mean their entire
Yeah, the
culture, and
nation is
you
the
can use a
same.
cookie cutter approach to your
Yeah.
treatment plan. You cannot
Hmm.
do that. Each
No.
individual is different.
We're all
So
designed
and
differently. We are
yes, and
designed differently.
definitely.
Mm-hmm.
I have clients who say all kinds of things about my belief system or who I am and what I am, but it
Mm-hmm.
does not offend me at all.
Mm-hmm.
Not at all. Because here's the thing: that is, always remember this. When somebody says something to you or is being prejudiced or is condemning your belief,
Mm-hmm.
this is how I look at it. I say, well, that is not what it is. It is
Mm-hmm.
their idea of it. It does
Mm-hmm.
not offend me at all. I
Yeah.
just feel like, okay, is this an opportunity where they want to be educated, or are they just doing this because they want a confrontation? So if it's a letter, I'm not even going to contribute to that
Mm-hmm.
conversation. I just like,
Mm-hmm.
okay, yeah, to each his own, right?
That's
But
right. Yeah.
if they're asking to know and they're curious, I will
Mm-hmm.
give you, I'll give you answers.
Yeah, that's right.
Uh,
Yeah. To be open and honest. And I think that's
yes.
imperative. Imperative. Yeah, absolutely. Right. We've got like about 3 or 4 minutes left. So what I'm going to
Mm,
do, because we've sort of like covered our 6 questions at the moment, Sombo, if I can,
mm.
just tell us a little bit about things that are going on in Pakistan at the moment. And you said you've experienced trauma yourself. Would you like to elaborate a little bit about that? Are you okay talking about it? You don't have to. I'm just thinking like, is it something
No,
you'd like to
no.
touch on?
Yes, yes. So, first of all, trauma. What is trauma? A lot of us think that, war veterans are the ones who feel trauma, and that's trauma, which is true. They do. Trauma is anything that at any age, for instance, a child, if the child is watching parents constantly fight, the child is going to grow up with trauma as well.
Mm-hmm.
So I'm just, going to simplify this bit,
Mm-hmm.
right? Just so because of the lack of time.
Mm-hmm.
We all experience trauma to some degree throughout our
Mm-hmm.
lives.
Mm-hmm.
It's important to process it. It's important to talk
Exactly.
about it. It's important to, and if you can't manage it on your own, I
Mm-hmm.
would urge everybody to seek help.
Talk to somebody.
There, please talk to someone.
Mm-hmm.
Please talk to
Mm-hmm.
someone, and it's okay. There's no shame in that.
That's right. Absolutely.
Your response to a threat is actually changing the makeup of your brain.
Exactly.
Your
Sending out
brain
different.
is
Yeah.
Yes, signals, and it's the alarm keeps going on
Mm-hmm.
every time there's a trigger, or the alarm goes off, right?
Mm-hmm.
So what you need to do is that, number one, there's no shame in
Mm-hmm.
seeking help. Please
Mm-hmm.
reach out. Don't worry about whether you have the means to seek therapy or not. A lot of people think that going to a therapist is something that requires a lot of investment.
Mm-hmm.
There are a lot of therapists out there that are going to see you without charging you anything.
Mm-hmm.
Okay, just ask. The first
Mm-hmm.
step is to ask. Now,
Mm-hmm.
with this situation right now in my country, I can already see that a lot of people are responding differently. Some are just going about their lives the way nothing's, like, as if
Nothing's
nothing's
happened.
changed.
Mm-hmm.
Nothing's happened. And
Yeah.
again, I understand that everybody has
Mm-hmm.
their own defense mechanisms, and
That's
everybody
right.
has been using those defenses since they were little, and
Mm-hmm.
those defenses right now have come into play.
Mm-hmm.
So there's going to be complete denial in some cases. There's just complete
Unfortunately
denial.
so. Exactly.
And
Yeah.
then there are people who are just like, well, you know what, this is going to be around for a very long time, so might as well get used to it. Are
Yeah.
you intellectualizing it? Because that's not going to
Mm-hmm.
help.
Yeah.
There's a disconnect that's taking place here.
Mm-hmm.
So there's a lot of that. So I do feel really bad. I cannot condemn any of them. I can't.
Mm-hmm.
I'm not in a position, because again, I don't know what their life experiences are, what their exposure is, and if they're doing something. It's sad. I
Mm-hmm.
really wish that people would listen to the experts right now.
Mm-hmm.
And
Mm-hmm.
again, that would be influenced by culture. Who
Mm-hmm.
do you deem to be an expert? Is it a cleric? Is it the head of the family? Is it going to be a priest? Is it going to be the politician? Is it going to be the doctor?
Mm.
I'm not going to answer that. Hopefully,
No,
I don't
and
need to answer that.
politics don't come into it, does it, Sumbul? Politics won't come into it, because if we listen to
No,
political leaders, well, that's another story in its own, and I won't even go
no,
there. I
a
would
can
say
of
go with the
worms.
science. Go with the
Can of worms.
science.
Go with
Yeah,
the science.
go with the
Please go
science,
with
and
the
let's
science.
leave it to the professionals
And
at the
here's the
top.
thing, and this is what I say: months from now, 8 months,
A
8 days
year.
from now, 8 months from now, if the medical community says, you know what, they throw their hands up in the air and they're like, you know what, do whatever you want to do. We have no answers. Then do whatever you want to do. But
Yeah,
until they've done that, can you please
yeah,
cooperate? Please
yeah,
cooperate.
yeah.
Just listen.
Absolutely, absolutely. Yeah,
Give them
absolutely.
a
I
fighting
completely.
chance. The
Mm.
medical community is not getting a fighting chance, unfortunately.
Yeah, yeah, you're absolutely right there as well, Sumbul. Absolutely. Well, listen, we're coming to the end of our show now. It's been really, really great having you on. I'd like to thank all the viewers who've been watching, all the lovely comments I'm seeing on the right-hand side here, who are commenting here. We've had a few people. Thank you for a good show. Well done, Sumbul. You've been really good on the show. Interesting program. Thank you very much. And also Bernadette Woodland, who's put something on there as well. She's put well done. And obviously somebody else who wants to come on the show, Kenan Huvardi. We'll see about that. But I'd like to thank all the viewers for watching, and hopefully see them again next Thursday. Thank
Thank
you,
you so
Sumbul, very
much.
much. Thank you so much. You've
Good
been
night.
an inspiration to us. Thank you so much. Keep up the good work,
Thank you so much
Sumbul.
for having me. Thank
Thank you.
you.
Speak to you
Thank you.
soon. Bye-bye.
Take care.